Hi, welcome to Body Talk today. I'm Sherry Russell, Nurse Practioner. Mike is usually with us, but he's on vacation somewhere today. And today we will be speaking with Amanda Knipp, who's the Clinical Director at Woodland Centers, and we are going to be discussing the topic of child abuse, different forms of child abuse, how to recognize these symptoms in your child, what to talk to your child about, and different treatment options and things that are available in the community. And welcome, Amanda.
Thank you. Thanks for having me.
Thank you. Would you like to tell us a little bit about yourself and what you do?
Yes, I am a clinical counselor and I work as the clinical director with Woodland Centers. I've been there going on 6 years and have been in the mental health profession about 12 years. So I've been working with children during all that time. So I'm pretty familiar with what we're seeing in our agencies and definitely seeing an increase in abuse and cases coming into the agency.
Okay. What have you seen over the years as far as how we are treating these children and things you're seeing in the office?
I think primarily what we see most, obviously there's abuse in different forms. There's physical abuse, sexual abuse, there's the emotional and psychological, and then the neglect. And we're seeing more of the more severe cases. Children coming in with more physical abuse, sexual abuse is something that we're seeing more of. And I think in my 12 years with that, I think over the last 3 to 4 is really that I've recognized the more severe cases of abuse that are coming in. And it's estimated that over 1 million kids are abused a year, and that's only the reported cases.
That's
and
scary.
and we know that there's so many more that go unreported. So it's a good topic to talk about and discussion to have.
Do you find that as time has progressed and there's more education and more recognition that you're getting more people that are more willing to come forward and say, hey, this is happening to me, or hey, I suspect this is happening to a family member?
Yes, and that's kind of the discussion today, is really to focus on education and awareness, because that's how we become more proactive in prevention.
Definitely.
And I think the schools are doing more outreach, wanting education, CPS doing more education in the communities, and even in the juvenile courts. It's something that we're just seeing an increase in our communities.
Okay. Are you finding that as with the drug problem, I know we'd spoken about this earlier, with the drug problem you're seeing an increase in this happening with children and them being subjected to a more variety of people, say for example, and what I've seen professionally, I've seen kids that have been sexually abused because mom and dad are passed out somewhere and they've got all these people running in and out, and people tend to be a little bit more transient in that culture. And they're subjected to being around people.
Yes,
that are.
It's a scary. 95% of children that are sexually abused typically know their abuser, and that's scary. And we know that 1 out of 5 boys will experience some form of sexual abuse before their 18th birthday, and 1 out of 3 girls will experience sexual abuse before their 18th birthday, and that's very alarming.
Sad and scary.
It is.
And I think we've all done a good job with our children. We educate them to, the stranger danger thing. Don't talk to strangers. Don't go anywhere with a stranger. If a stranger approaches you, run, yell. That's I remember years ago. That's what I taught my kids.
Absolutely.
But how do you talk to them about people that they know, whether it be a parent, a family friend?
Sure.
Yeah. How do you talk to these kids, and what would you recommend to parents to say to their children to make them know that it's okay to come forward and say something if it's a trusted family member or friend that's abusing them?
Sure. I think most importantly is having the conversation, that it become a regular topic in your home, and that it's okay, that you're educating them, that you're letting them know that it's safe to talk to them, that you're identifying safe people in their life that they can speak to, whether it's an educator, people that they can go to. It's just, I think, increasing conversation about it. I know for me and my children, it's things that we do talk about. What to be aware of, and so I think the most important is to just ensure safety and have conversation about it.
Okay, absolutely, and I think that's the key to it too. Is your child has to be comfortable coming to talk to you, and knowing that it's okay. And I have seen over the years. Sadly, I've seen it more than once. People will have told their parent that they were being abused, and the parent didn't believe them.
Sure.
And I think there's nothing more sad than the person that's supposed to be caring for you and being your number one person you can go to that for that child, to have that courage to go to that parent, and that parent say, I don't believe you.
And that is one, when you look at why children resist or are more apprehensive in talking, fear is one. First, we know that typically the abuser is dominating, is making threats, and so that fear is for their own safety, safety of their family, but also fear that they won't be believed, because that is very common, and just fear of this connection that they have with the abuser, of what that may do to them. And then I think it's just important to also recognize for parents is that abuse is trauma, and trauma is experienced differently for us. And trauma is stored in our emotional brain, our midbrain, and it's also stored in our implicit memories. And we have to recognize that our emotional brain doesn't have access to language or to reasoning. So what's already a difficult topic for kids to talk about, it's very difficult just to verbally articulate. So a lot of times it's, again, the more we talk about it, the more easy it becomes for children to know that it's okay and safe.
Good. What kind of signs would you tell someone to watch for with their child that may start setting off some alarm bells, something that they maybe need to further explore? If you see what kind of behaviors out of your child would cause some red flags?
I think keeping in mind is that you know this child, you know their behaviors, what's normal, what's normal. And any sudden or gradual change in that, I think that it's very important to just always be attentive. When you see a change in behavior, I do want to say that doesn't mean that it's sexual abuse. It could be just adjustment to difficult situations. So you want to be aware of any changes, and you want to address it sooner than later. Some of the changes we typically see is isolation, withdrawing from their peers, from their family, not wanting to be out in public for fear of not feeling safe. We often see an increase in disruptive behavior because that's how they know, that's how they are experiencing the trauma. Anger, aggression, we see an increase in depression, we see an increase in, or a decrease in self-esteem, acting out sexually, and not just your normal sexual development for a child, but what is not appropriate development. Changes in appetite, changes in sleep, trusting. They start to develop trust issues with their family. There's multiple signs and symptoms, but those are primarily the ones that we really want to focus on addressing. And again, I just can't stress enough the change in the behavior is when you start to see that, be aware and start having discussions, and just open discussions, and ensuring an environment of safety that they can talk. So
I think it's very important. And I think, with the abusers, you see that fear factor, like we were discussing, that, if you say this, they're not going to believe you, or if you say this, I'm going to hurt somebody that's important to that child.
Yes, so often.
And it seems like these children have been groomed from a young age.
And that's what's so heartbreaking, is that it almost becomes confusing to them. They have this affection for their abuser, and they don't recognize that of course, that's normal. And it seems that that shouldn't be normal, but that does happen. They start to have the confusion with, and then also the fear, because by that point they've typically groomed them. They've bought them gifts, they've given them all this affection, and then the abuse occurs, and that's the cycle of abuse, so it makes it more difficult.
It is. What are you finding, or what have you seen as far as the prosecution of these, when children finally do have the courage to come forward and tell someone? Do you find that, are you brought into court very often to deal with that aspect of it? My
role, I've been involved in a few cases where there's been allegations, but I've never been in one that's been completely substantiated that I provided any type of feedback to the courts. So it's been more, I've been engaged in more of the substantiated, but also I do know the courts take this very seriously, and that's why it's so important, that it is coming out, because they are taking this seriously, and they are hearing children, and so speaking it from that aspect, I don't know as much with that.
Are you finding, I'm assuming that maybe teachers would have play a large role in recognizing any of these signs of abuse and knowing these children. Teacher deals with these children every single day. So and sadly enough, our children spend more times with the teacher than they do with their families.
Absolutely. And I think that's so important too, is that if you're in a position that you work with children, you know these children, you with them daily, especially educators, you know them daily, or you see them daily and you know them well. So even then, being aware, it's just kind of our responsibility. I think as adults, our responsibility in anything we do, that we're attentive to children, and being more than just present, that we're really being intentional about paying attention to what's going on.
With them. What resources are available locally in the community for someone that's wanting to get their children in for counseling and for treatment?
Okay, well, obviously, Woodland Centers, we do have several therapists there that are certified. I'm certified in trauma care. We have Taryn Mink, who works a lot with children in our agency. We have several case managers that are in the schools. So we have definitely a resource would be Woodland Centers, but there's other agencies. Wing Haven, I know Amy Sisson is certified in trauma and does a lot of work, and we refer children to her as well. There's integrated services, any community mental health agency I would recommend, definitely that would be the first thing that I would recommend, is getting them in to some mental health professional to really determine, because addressing trauma and abuse, it looks a lot different than our regular mental health counseling that we do. It's we address the nonverbal approach to that initially before we can really get into a more cognitive approach to trauma.
So it sounds like there are a lot of resources in the community.
Yes.
It's just, I think, finding and identifying and getting these children placed in the appropriate way.
I agree. And there is. And then look, I mean, just getting familiar. I know our Adams Board has resources out in other counties, Jackson County, Meigs County. So just really getting to know the resources and getting to those as quickly as possible.
Okay. One thing I have found professionally when I'll see people in the office for mental health reasons, they've had years of untreated depression, anxiety, whatever the underlying cause may be, and then when you start speaking with them, and of course I'm not a counselor, I just do the medication management, but it's, they talk to me about these things as well, and you get, when they get to feeling more comfortable with you, it's like, oh well, 20 years ago this happened and I didn't tell anybody, and I've still not ever told anybody, and it's very heartbreaking to see these people that have had this happen to them as a child, and then how it manifests as an adult, and the things that they go through over the years, when, if recognized and appropriately treated early on, it could have greatly improved the quality of their life.
Early intervention is so critical in just working through abuse and trauma. And you're right, I mean, it's not uncommon for me to see adults, into adulthood that have never talked about abuse, that have never talked about it, and then start to disclose that.
Yes, definitely. And I think what we'll see a lot of, and what I've heard a lot of professionally, is there'll be, it's everybody knew it was happening, it was something that was multi-generational and just never discussed.
Yes.
It is.
And it's just, again, it's kept in the closet, we don't talk about it, don't encourage kids to talk about it, and I think that's really another thing, and when talking about the communication and why it's so important to talk about it, is that starts to break the cycle of the generational abuse. The more we talk, the more we make people aware.
Absolutely.
So that's pretty critical.
Okay. But that's, that is, I hear it all the time. It's just the way it always was,
It almost becomes normal, and that's heartbreaking to know that, and I still see that in adults that devalue themselves so much because of the abuse they face, and that just, they still own that, and there's so much more value to them, and they just can't hardly see themselves out of that role, and that's what they're worthy of, but they're worthy of so much more, and they're just, it's hard. I mean, they've been, again, just the fear, the psychological process of abuse, that in itself makes recovery difficult, but it's so possible. But early intervention is important, and I can't stress that enough, I think, is
with that. One thing I've noticed, which is a little different than the typical child abuse that we think of, but when we look at the bullying factor with the schools, which it is abuse. It's in a different aspect than what you would think about when you think of child abuse. But I know I see a lot of that, and people are having a lot of psychological issues from that, a lot of depression, anger, especially when you get into the teenagers. We see a lot, they just manifest these feelings as anger. And that is what you see a lot of. They don't know how to process it, and they're just mad all the time. I'll have them come in, and mom will say, I don't know what's wrong with them. They're just mad. They're blowing up all the time. I don't know if it's just a teenage thing or what. And you get talking to them, and school's not a good place mentally for them, because they feel that they're being bullied every time they go in.
And it's not uncommon, you talk about that anger and that aggression, and it's not uncommon for children to be misdiagnosed with other mental health diagnoses, when in reality a lot of it is a reaction to some type of traumatic event or abuse. Again, when someone has a trigger to trauma, whether it's, say that it's an 8-year-old that's in a class and it sees a color that reminds them of their abuser, or they smell a cologne that reminds them of their abuser, they may initially just, that's their reaction. It's triggered in that emotional brain, and their reaction is an emotional reaction. It's going to be anger, it's going to be aggression. They're typically hypervigilant, always around, hyper aroused. They may look hyper because that's, again, their little emotional brain is just overactivated, and it's not able to think more critically or logically.
Absolutely.
So when I see changes in behaviors and when I hear these behaviors, I don't just see trauma, I don't just see abuse, but I look at that picture. I look very deeply into that. Like, there's a lot more going on, especially a sudden, if someone's 9 years old and all of a sudden these symptoms we start to see, I have to ask myself, okay, what's going on here? Let's look more critically at this. And it could just be, again, it doesn't mean that it's abuse, but
absolutely,
we have to rule that out.
Yeah. And I get a lot of parents that'll, and I don't do medications for children under 12. Because I feel that needs to be handled by someone that is their specialty. But they'll bring their children in and they'll say they've got ADHD. They're all over the place. They're hyper. They need medicine to help them focus. And when in fact, when you get talking to the child, and it's anxiety that is presenting as being hyper, and it's and it's getting to that, and that's why I think it's. And people will come in and they'll say, I don't want to do counseling, I just want some medicine to make it better. I'm like, no, you can't do that. I always tell everyone, it's like pieces of the puzzle.
Absolutely.
You can't have just one thing that fixes the problem.
You're right.
It's very multifaceted, it's multifocal, you need to pull everybody in with it. And medications can be beneficial, but medications are not the magic answer.
You're right.
And that's the thing, is I think counseling is always important. We're going to take just a brief break here for just a few seconds. Welcome back to Body Talk. We have Amanda Knipp with us today, Clinical Director at Woodland Centers, and we're discussing childhood abuse and trauma, and some various things available in the community to deal with such. Amanda, what would you recommend if someone, I know we kind of briefly discussed this, but what would you recommend if somebody really wants to get their child help? Who do they call? What do they do?
I think initially is finding your resources, and whether the community mental health or the mental health agencies in your community, reaching out to them, setting up your initial appointment and going through a process. And I encourage, if it's an urgent matter that this child needs to be seen, there's also crisis services available with in our communities, and that would be, if you feel that it's something that can't wait for an appointment to be addressed, you could attend or go to the local ER. They will call the crisis services that are available to do an evaluation. And what goes from there determines on the evaluation. A lot of that is just referral to outpatient, but sometimes that crisis intervention needs to occur just to stabilize a crisis if a child is in a crisis. Certainly being sure that this is getting reported to to Child Protective Services, to our local law enforcement, and just trying to ensure that that child is safe and doing the best that we can to keep them safe. But definitely not prolonging getting them into services. We said earlier that that's the sooner we get them into services and that we actually start the intervention with them, again, it's more effective, and it doesn't mean that it can't be effective later on. It's just definitely encouraged to do that immediately.
Absolutely, and immediate safety, of course, is the ultimate concern. Ultimate concern. We hear every day of sad things that happen, and people are like, well, I kind of thought, but didn't want to get involved, and I know, and bless the CPS workers, because I could not imagine dealing with that every day. I don't know, one thing that we've seen a rise of in the last couple years, which is a form of abuse also, is the sex traffic industry. When they're luring these young kids in, they're becoming addicted, and then they're disappearing. And I know, here locally, we've had several women disappear in the Chillicothe area here in the past couple years, and that is one theory that is what's happening to those girls.
And yeah, I agree, and we're seeing more of that. And what I like too that our communities are doing, we're seeing more education, more outreach, really trying to inform, because again, this is something that it's not talked about. And we're finding the more we're talking about it, just again, the more effective it is to intervene. And the other thing too is often victims of child abuse, physical or sexual abuse, are more likely to be engaged because they're already very vulnerable. And so we want to be aware of that too. But I had attended a training, we were talking earlier. It was last year, so I'm hoping this is still a current statistic, that Ohio was 5th in the country for the highest rates of the sex trade and industry. So that's
sad and scary.
It's concerning.
Yes.
So
yeah, and as you know, as the I'm a grandmother now, so as you know, with my grandchildren, my children are grown, but as with with your grandchildren, you just want to hold them close and never let them out of your sight. And but I think and what I have seen on the medical end, you see, I've treated some girls that had been in the sex traffic industry out of Columbus at a previous office that I'd worked in, and it was all ages. You think young girls, and they're brought into this, but there was a variety of ages.
Yes.
I'm talking from 19 to mid 40s at that point in time, and the one thing they all had in common was that they all had addiction issues. And then they had gotten pulled into this, and I talked to them, and people are very willing to tell you their story and what happens.
Yes.
But they get pulled in with these addiction issues, and then before they know it, they have no control, and they're being solicited out. They're being prostituted for the
yes,
for the benefit of someone, and they're keeping these
benefit.
people addicted, and it's a vicious cycle.
It is, and once again, it's a very psychological breakdown, and which no one intends to get to that. No one intends that, but it does. I mean, people can be psychologically broke down by first the initial addiction, and then just the abuse that they face on a daily, just the daily occurrence, and again, it becomes so hard for them to get out of it once it's engaged, and even the wanting to. We've had individuals in our office who have been traded by family members for drugs or for services, and again, part of our process is just building back up their value to where they recognize that it's not okay for people to do this, that it's not okay for people to harm them in that way. So.
I have had patients tell me that their mother or their father traded them to their drug dealer for drugs.
Yes,
and it breaks your heart. It absolutely breaks your heart. And we had done a lot of discussion earlier on how drugs play a role in this, and of course it's not the whole role, but it does, I think, set people up to be in a more vulnerable position.
It does.
There's of course abuse has been around for centuries, and it just keeps coming. But I think this kind of puts a whole new different spin on it, and puts more people at risk.
There's so many confounding factors right now that just contribute to the increase in the cases that we're seeing, and we're to the point that we're losing 5 children a day to some form of abuse, and those numbers are just continuing to increase, and that's not counting all the ones that are just living in just emotional pain and suffering, and the addiction plays a role into that. Drugs play a role. The dynamics of the family system plays a role. There's so many different things that we have to consider when working with individuals who've suffered from abuse.
Are there any current local coalitions that are focused on child abuse and prevention and educating the public, and trying to engage the different agencies that may be involved in that?
That's a good question. I don't know of any specific, and I hope that if I'm missing anyone, I'm very sorry. I do know that we have regional trauma-informed care meetings, and a lot of that is directed towards trauma as a whole, but very much to setting up trainings and community outreach for schools, trainings for professionals and for families, and abuse is covered in that. So we have the Trauma-Informed Care Initiative, which is regional, more part of the Athens. Of course, your Family Children First Council, that's always something that's definitely part of theirs. Discussions that help me grow. I mean, all of these agencies that do work for families do have a level of discussion about abuse and prevention.
So there's different resources out there available for people.
Yes.
And I know we had talked about abuse and trauma, and how would you differentiate for the general public what the difference? Because of course child abuse is very traumatic.
Yes.
how do you treat those differently on a approach, like on a counseling approach?
Typically, the abuse is usually a traumatic experience, so we try to address that in an indirect, nonverbal, sensory-based process initially, because it is so emotionally centered in the emotional brain that we really focus on stabilizing them, helping them learn to recognize their triggers and to self-regulate, and then moving into kind of, we call it creating their narrative, telling their story, and that becomes more cognitive. So I would say abuse, even in abuse in general, if there's high levels of abuse, some kids can be more resilient, but I honestly don't see that as much as I just see the trauma. So we approach it from an indirect, again, creating safety, just your nonverbal, sensory-based approaches, and then moving that on to more of a cognitive process to help them through it. And they recreate their story to where they learn to thrive and to be we used to say survivor, now it's thriver.
Okay, great. Well, Amanda, thank you so much for coming and taking your time to speak with us today. It's a sad issue that unfortunately we get to deal with all too often. And but thank you.
I appreciate you having me. So
thank you. And if anyone has any questions, call Amanda at Woodland Centers.
Yes.
Thank you.
Thank you.